Now, the push by the government to fast-track the social health insurance bill got a major boost, with members of parliament from across the political divide supporting the amendments. The bill, which seeks to establish a social security insurance authority to replace the current National Social Insurance Fund, NHIF, passed the second reading and is expected to be tabled before the Committee of the Whole House on Wednesday. Once enacted, the bill will see taxpayers deducted a mandatory 2.75% of their salaries to fund it. And as Mary Morki reports, the proposed new taxation has been met with uproar from civil society organizations who have cautioned the government against overburdening Kenyans.
As part of its campaign pledges, the Kenya Kwanza government committed to accelerating attainment of universal health coverage as one of the core pillars of its bottom-up economic transformation agenda, and ensure Kenyans access quality healthcare services without suffering financial hardship. The proposed Social Health Insurance Fund Bill 2023 has, however, been met with public outcry over the proposal to impose yet another mandatory tax to finance the fund. Majority Leader Kimani Ichung'wah has, however, defended the bill as a necessary undertaking that will revolutionize the delivery of healthcare in the country and root out cartels that have looted funds meant for ailing Kenyans.
The Social Health Insurance Bill of 2023 seeks to accelerate the progress that we have made in these reforms and actualize universal health coverage. NHIF has also turned to be potentially financially unsustainable under its current structure. Therefore, Honorable Speaker, it is against this backdrop that the government proposed to have a paradigm shift, a complete paradigm shift in the provision of social health insurance.
The elephant in the room is corruption. If that is sorted out, you will see every Kenyan will get quality service in the healthcare by the healthcare providers, Madam Speaker. Until we bite the bullet and we deal with the cartels and the corruption in the health sector, nothing will change. I can promise you. But in my view, let us not also condemn the whole institution of NHIF as it is today. It has also done some good work. So let us sieve the chaff from the wheat.
Members of Parliament, however, expressed concerns over the fate of thousands of NHIF employees after the establishment of the proposed authority.
This bill, I expected a transition clause that says that the people who are working on NHIF are deemed to have, when the new institution is created, they are no longer in service, but they should be given priority in accordance with their qualification and competence.
Away from the chambers of the National Assembly, the proposed mandatory monthly deduction of 2.75% on taxpayers' payslips has elicited sharp criticism from civil society organizations who have faulted the government of being blind to the plight of Kenyans by continuing to levy more taxes. The Okoa Uchumi Group has also accused the government of turning public participation forums into a mere charade and disregarding Kenyans' input in those forums.
The proposal to have a mandatory 2.75% monthly contribution from the employees' basic salaries for the health scheme is excessive and will further strain the taxpayer.
Currently, our tax system lacks predictability, which poses difficulties for both individuals and businesses, as it heavily relies on financial legislation introduced annually.
The Social Health Insurance Bill is among 4 bills proposed by the executive for fast-tracking by Parliament to operationalize the health plan. The other bills are the Digital Health Bill, the Primary Healthcare Bill, and the Facility Improvement Bill. If assented, the bill establishes 3 funds: the Primary Healthcare Fund to cater for primary health care, a Social Health Insurance Fund, and a Chronic Illness and Emergency Fund that provides for chronic illnesses like complications of diabetes, hypertension, and cancer management and emergency treatment. Mary Morki, Citizen TV.
Counties continued splashing huge